This is a special podcast produced on site at SHSMD Connections 2022 as we talk with keynote speakers and session leaders direct from the show floor. I'm Bill Klaproth, and with me is Jamie Shields, System Vice President of Consumer Experience at Advocate Aurora Health. Jamie, thank you for being here.
It's a pleasure. Thanks for having me.
You betcha. And Kelly Jo Golson, she is the Chief Brand and Consumer Experience Officer at Advocate Aurora Health. Kelly Jo, welcome.
Thanks, Bill. Thanks for having us.
Absolutely. So we're going to talk about liberating the consumer identity to drive engagement and transform outcomes. Kelly Jo, let me start with you. So why has the patient experience become difficult for consumers to manage their health and wellness?
Well, and I think it's beyond just the patient experience, the experience of consumers to begin with, as you're navigating the world across multiple channels that are so disconnected. Even just in your outside of healthcare, you might be going from your laptop to your smartwatch to your iPhone to a tablet, and very disconnected and discombobulated. And we were starting to find the same thing in healthcare. Whether I was trying to make an appointment to come in for a diagnostic, for a primary care visit, I'm seeking test results, I want to chat with my physician, I want to do a virtual visit. Having to connect in these disparate ways and really just creating this hassle map for consumers has been unattainable.
I love that hassle map because it's a hassle, right? So that's what you're finding. This experience for our consumers is there's a hassle. It's a process. So Jamie, let me ask you then, how have you simplified the consumer experience at Advocate Aurora Health?
So we've been doing quite a bit of work to really create seamless connections. So we have a digital platform that we've introduced to our consumers called LiveWell. Makes it very easy for them to log in, get their information. They can do all the things that Kelly Jo referenced. They can schedule those appointments. They can get a quick care visit with a virtual quick care visit. They can also look at health and wellness information. You need a recipe for dinner? We've got that for you. You need a guided meditation? We can do that too. That platform really starts to create a single destination for consumers to start to not only transact with us, but engage with us as well. And again, not just around sick care, but a much broader look at overall health and wellness.
So this is a management system you've put together, basically, is that right?
It's a single digital platform. So whether you're using a mobile app or you're on a website, you can log in or not. We have guest access, so people don't have to be a patient. They don't have to be affiliated with Advocate Aurora Health. They have access to those tools.
So they can book an appointment or find test results or find what they need in one basic dashboard? Is that kind of what it is? You're kind of...
One single location.
You've eliminated the hassles. You've removed the friction from the process, basically. How long did it take you to do this or put this thing together? It sounds great.
We've been working on this for about 3 years, which has been good. And it's been that journey that a lot of health systems go on. You start with your health record. You've got that transactional tools that the health record provides. And over the last several years, we've been adding layers of health and wellness onto it, again, to simplify that process. It's a one-stop shop. It's omni-channel, if you will. Again, if you're doing it on a tablet, if you're on a mobile device, if you're moving to a website, it's the same experience. So depending on where you are and what you're trying to do, again, one place to go to do all those things.
Yeah, and Kelly Jo, what have the results been so far?
The results have been phenomenal, and I'll share a few things. And the one thing I also, Bill, wanted to add is certainly we are setting out to improve the consumer experience, to make it personalized, to make it simplified, but we also know this will allow us to improve the health outcomes. Preventative medicine, we know who you are. If we know you're predisposed for diabetes, obesity, whatever the case may be, and that we're able to connect with you proactively to serve you up, the information, the recipes, the advice, the guidance, check in with you. We're also tracking the impact we're able to have on health outcomes. But so far, success has been great. We've got about 1.5 million downloads of the app. So we've had some really great response, and we know this is going across all socioeconomics. Where at one point folks thought it was just millennials who sought to use that app, we now know that it's cutting across all ages, and the utilization is really up. That's perhaps what we're more excited about than anything. It's not just the downloads, but we've seen about a 400% increase in the daily and weekly engagement. So our users are coming back.
Wow, that's amazing. And I love how you said it improves health outcomes. It seems like that's the bottom line benefit of this is people are able to access the health information they need, make appointments easier, and generally improve their health through this app because you're making the process easier. Is that fair to say?
Absolutely.
Wow, 1.5 million downloads. That's crazy. Wow. Okay, last question, and thank you so much for your time. Kelly Jo, I'll ask you first. What kind of someone listening to this going, I want to do that. How do you start this process? How do you even begin to go down this road?
Well, for consumers, we'll say anyone that's listening, you too can download our LiveWell app. So,
great.
Regardless of what market you live in, we have that available, so you can access great health and wellness information. But I think it all starts with consumer insights, and I will just say for us that was paramount, of understanding the consumer needs, understanding their trends, their utilization trends, and building something that was going to best meet those needs. So I think first and foremost, always go to your consumers. Always go to your patients and better understand what they're seeking and how you can best serve those needs.
Yeah, I love that. So great. Thank you for saying that. Download the LiveWell app and you can see it in action and see what you've done, and you can go, wow, this is okay. It can do this. It can do that. So that's kind of a good roadmap. Is that right, Jamie? And final thoughts from you as well.
Yeah, and I would agree with that. Is you get that experience and this idea of liberating the identity. It's not just a health record app. It's a health and wellness engagement app. And it really will help you get a better control over that clinical activity as well as the health and wellness activity. And as Kelly Jo said, we're looking at how we empower consumers to live well, hence the Live Well name there. And that's what that platform is designed to do.
It's aptly named.
Yeah.
I love it. That's great. So download the LiveWell app. Thank you for sharing your story with us. This has really been insightful, and it seems like something we all should do, a roadmap for the industry to follow. So, Kelly Jo, thank you so much for being here.
Thank you.
Jamie, thank you for being here as well. We appreciate the time.
Thank you.
And make sure you sign up for this year's SHISHMED virtual conference, October 12th, 2022, plus on demand through the end of the year. The virtual conference will feature access to 50-plus sessions recorded from the September in-person annual conference, plus all new live sessions. Just go to shishmed.org, that's shsmd.org/virtual, to learn more and to get registered. And please join us at the next SHISHMED Connections annual conference, September 2023 in Chicago. And if you found this podcast helpful, please share it on your social channels and find access to our full podcast library at shishmed.org/podcasts. I'm Bill Klaproth. As always, thanks for listening.